Today we're going to talk about the UCY Diabetes Prevention Program. It's a lifestyle change program that will be starting next week. My name is Ashley Parker, but I do go by my last name, so you can just call me Parker. I'll be the coach and the facilitator for this program. I have a master's in nutrition for wellness and health coaching. And in my previous work as a nutritionist and a health coach, I helped pre-diabetic individuals with incorporating healthy lifestyle changes to help improve their overall health and metabolic numbers and um, things such as that. So I'll be going over the program in a little bit more detail. We'll discuss the roles and responsibilities for me as your coach, and then for you as participants. We'll talk about what to expect in the program, and we'll have time again for questions at the end as well. So the Diabetes Prevention Program is a UC-wide program with CDC-approved curriculum, and this is designed for folks who are diagnosed with prediabetes or at high risk for developing prediabetes and who also want to lower their risk of developing type 2 diabetes. The program is a year long. There are 22 total sessions, and there are goals associated with the first and second halves of the year. So by the end of the first 6 months, one of the primary goals is for participants to be getting at least 150 minutes of moderate physical activity a week. This is the CDC recommendation for us to be in good health. And the second goal being to begin to see changes towards your weight goal. So the CDC does track changes in weight for participants. It's one of their data metrics that they use to assess the effectiveness of the program. And then by the end of the year, the ending goals and continuing goals is to be continuing our 150 minutes of physical activity a week and to keep working towards the weight goal that you have if it's not yet reached. And the primary overarching goal of the program is to incorporate and make sustainable changes that can be practiced long terms in your daily lives. And so hopefully improving how you feel. Do you feel better? Do you have more energy? Are you feeling better in your body? So various markers like those. Next, we'll talk about how the program is structured. Like I mentioned, there are 22 sessions that are held over the course of 1 year. 21 of those sessions are virtual, and then we have an opportunity to meet in person for one session. The classes are an hour long and will be held on Tuesdays at this time, so from noon to 1, starting next week on January 21st. For the first 3 months of the program, there is one session a week. So for months 1 through 3, we'll be meeting every week. In month 4, we'll be meeting bi-weekly. So the classes are 2 weeks apart. And then for the remaining months 5 through 12, we'll be meeting once a month for our ongoing maintenance phase. So it is quite a commitment to do this program. And it also requires a lot of work outside of the sessions that we share together, where you'll be learning how to apply the information that we learn and how to incorporate into your daily routines. But really, one of the biggest benefits of joining a program such as this is to have the supportive environment of having a health coach guide you throughout the way, and also having a supportive environment with peers who are sharing the journey with you. So here is a schedule for all of the session modules. that we will be going through, starting off with an introduction to the program next week. Our first topic about lifestyle changes will be getting active to prevent type 2 diabetes. And there we will be introducing the fitness log where you'll be tracking your physical activity. And I forgot to mention, but throughout the whole program, you will be also tracking your weight. And these are the two metrics that the CDC requires to track the effectiveness of the program. And so with these two markers of weekly weight and then weekly physical activity minutes, you'll be submitting those to me beforehand, and I'll talk a little bit more about how to do that later on. For our third session, we will be talking about tracking physical activity and then how to eat well to prevent type 2 diabetes. So we'll be getting to the nutrition. And then in session 5, we'll talk about tracking our food. There is a lot of tracking. Tracking has been shown to be really beneficial for behavior change and people trying to implement new habits because it gives you a visual representation of the progress that you do make. For tracking food, it is also a tool. It's not required, but for those of you who are interested, then it can be a helpful tool. Next, we'll be talking about how to get more active in session 6 as we incorporate all these healthy habits and getting into our physical activity daily routines. There will be times that you get stronger, and then we'll talk about how to take your physical activity to the next level up. Then we'll be talking about energy in, energy out for session 7. And so a little bit getting into the metabolism of nutrition and calories. Then we'll talk about eating to support our overall health. In session 9, we'll talk about managing stress, preventing type 2 diabetes and chronic health conditions is multifaceted. So it's not only getting in physical activity and eating well most of the time, but also doing things like managing stress and getting good sleep as well. Then we'll talk about eating well away from home. This can be when you're out in your daily lives, like at work or doing errands. Also, when you have social get-togethers, maybe you're going to a potluck or a holiday party, and even vacations. So there's a lot to get into there. Then we'll talk about managing our triggers and how to navigate that when they come about. For session 12, we'll talk about staying active to prevent type 2 diabetes. It is very much an ongoing process. And in session 13, we'll talk about shopping and cooking to prevent type 2 diabetes. And this potentially is the session that we'll do in person. But of course, for the whole program, we'll be getting into topics that are most beneficial to you. And so for this as well, there's some wiggle room. So we'll definitely take a look at everyone's schedules and availability for that. For session 14, we'll talk about taking charge of our thoughts and helping to focus us in our journey. In session 15, getting back on track. Sometimes we might get a little bit off, and we'll talk about how to veer us back on to where we are wanting to go. In session 16, we'll talk about getting support. Having that social support system around you can be very powerful in helping us achieve our goals. And so we'll talk about that in our own lives, and then social support within each other, because after all, it is a support group as well. In session 17, we'll talk about staying motivated to prevent type 2 diabetes. Motivation definitely changes over time, and we'll talk about how to motivate ourselves as well. Session 18, we'll talk about what to do when weight loss stalls, incorporating habits, and if your goal is to lose weight, then sometimes these things can plateau, and we'll talk about ways that we can approach that, and also even other markers of health, because when you don't visibly see anything, maybe you're feeling stronger, maybe you're feeling better and feeling good about the choices that you are making. So we'll talk about different ways to stay motivated at those points. Next, we'll talk about getting enough sleep. Again, preventing type 2 diabetes with a holistic approach is the most impactful because all of these different areas intertwine with each other. And so getting enough sleep is, of course, very important for our health as well. Then we'll talk about more about carbs. We'll talk about some of the truths and the myths surrounding carbs and preventing type 2 diabetes. We'll, in session 21, talk about finding more time for physical activity. I know for myself, sometimes depending on my schedule, it can seem pretty hard to find times to fit that in. And so in those moments, what are some things that we can do? And then for our final session, we'll talk about preventing type 2 diabetes for life. As for roles and responsibilities, for me as your facilitator and lifestyle coach, my responsibility is to facilitate a supportive and respectful group, also creating an engaging space for us to have an encouraging and collaborative discussion with lots of creative problem solving. And I'll also be responsible for keeping us on track of time as well. Additionally, as a coach, my role is to be a guide to help you figure out how to incorporate all of these changes into your lives personally. Everybody is different, and so it is most important for everyone to have the self-confidence to incorporate these changes and figure out ways that they fit according to you and your goals. Because if we're following what someone tells us to do, research shows that is actually not as effective as finding your own way in your own journey to fit those all into your days. But I will be here to help you navigate barriers, and you'll also have each other to lean on and to get ideas from as well. So I will help relay education to you and knowledge about factors that impacts prevention of type 2 diabetes. And as participants, your responsibilities are to track the minutes of physical activity that you have. You'll have a fitness log and additionally tracking your weight in the that log as well. And you'll be needing to send those to me before the sessions so I can record them. And additionally, those are the 2 data points that we use to see how everyone is doing. Tracking our food is not required, but if that can be a useful tool for you, then I encourage it. And as we go through each of the sessions, you'll be incorporating these habits, of course, into your daily lifestyles as well. You'll have a participant notebook, and so that is a PDF document that I'll be sending out to you before each of the sessions. And then, of course, being ready to participate. With tracking, there is a lot of emphasis on physical activity because it is a very powerful form of medicine, and also the tracking of weight as well is, like I mentioned, something that the CDC uses to track our progress. But also, aside from that, I encourage you to look for other ways to track your progress as well. And so that might look like how are your energy levels throughout the day? Do you feel like you're excited and looking forward to the physical activity plan that you have moving forward? Are you meeting your goals for nutrition and sleep and that sort of thing? When we get together in our sessions, we'll start off the meeting with a welcome and review. We'll always start with reviewing the previous week and checking in on how everyone is doing. Then during the main part of our session, we'll get into the current topic of the day. And again, we'll be referencing those guides and also sharing ideas with each other too. Before closing everything out, we'll create an action plan. And so this is a specific plan on how to incorporate these changes into your daily routines. And then any potential barriers that might come around, we'll talk about how to navigate that to fit these into your life. Then we'll take questions, of course, at the end before we close everything out. So for signing up, the DPP program does have some criteria for participants to meet. The first being that you're 18 years or older. Next, having an overweight BMI. Third, having not been diagnosed with type 1 or type 2 diabetes. And then fourth, being currently not pregnant. And then additionally, one of the following three criteria needs to be met as well. So being diagnosed with pre-diabetes with a qualifying blood test, or being previously diagnosed with gestational diabetes. And then finally, if not either of those, having a high risk result on the pre-diabetes risk test. And that risk test is shown at the bottom as well as the underlying link on the screen in the right-hand side. And I'll be sending the presentation out to you at the end as well. And so if these apply to you, then you would be eligible for the program, in which I will be sending out to everyone an email application with the PDF on how to apply the form that you need to fill out with your health information. The email that I send will be virtue protected. And so that means that when you hit reply to the email that I send you with the form and attach your completed form, then all of your health information will be protected. So I have Virtue and I'll activate it so that when we correspond over email, your information is protected over Virtue as well. However, if any of the criteria does not apply to you, say if you haven't previously diagnosed with type 2 diabetes, you're still welcome to join the program, and we will still ask that you submit all of the requiring tracking, such as the weight check-ins and the physical activity minutes. But I do want to be sure that you're in communication with your healthcare provider and checking in with them to see how this program can best apply to you in your situation. For instance, and this can go for everyone as well, but there might be certain healthcare considerations that your doctor would like you to be mindful of. And so when you get the okay from that, we are happy to have you join. There's a lot of really good information that can benefit you as well. All right, so just a quick summary of what we went over. The curriculum here is all CDC approved, so up to date with all the latest research and proven methods on how to best lower your risk for developing type 2 diabetes. The program is 1 year long with 22 sessions. For the first 3 months, we'll be meeting weekly. For month 4, we'll be meeting bi-weekly, and then the remaining 7 months will meet once monthly. 21 of these sessions will be virtual over Zoom like this, and then one of them will get the opportunity to meet in person. Each session discusses how you can incorporate these changes into your own personal lifestyles to help prevent type 2 diabetes.